It's the first time I'm going to talk about robotics without putting a single video in the presentation. I feel ashamed of that. But this is going to be a little bit more of history and society than actually robotics. While I was listening to the previous presentations, I was thinking about this. We are more similar than we think. We think that Brazil and India are that far away, but it's not. So a bunch of the papers I'm going to show here are all from the Brazilian College of Surgeons journal and from Brazilian literature. So that's why it's unknown knowledge. If you analyze the GDP of Latin America, you're going to see Brazil on top of it. But if you analyze the GDP per capita, then Brazil goes down because we have a large population and a very heterogeneous distribution of money. Brazil invests 8.9% of the GDP, which is about $200 billion, in healthcare. If you compare that to the United States, they invest 17.7% of the GDP, which is $3.1 trillion. So one simple question, can we do the same treatment with this disparity in investments in healthcare? That's impossible. You cannot apply the same thing. And Brazil, like I said, is very heterogeneous. So if you look for Brazil, for the states, the GDP would be something like this with the European countries. But that does not reflect with the HDI, because there is a lot of inequality in the country, a lot of disparities in the country. So although you have a significant amount of money, it's not distributed well throughout the population. So where do we stand? Let me start with laparoscopy, and I'm going to go to the robotics. Like everywhere else in the world, we started laparoscopy in the 80s. But a very unique thing about Brazil, and then later we can talk about India, if that's the same or not. The business model for laparoscopy in Brazil developed on a surgeon-centered basis. So basically, there is a hospital culture in the country of disregarding the acquisition of devices. So they make the surgeons to buy that. So I'm a laparoscopic surgeon, I'm going to buy my tower. So that's my tower. And I'm going to rent to my patients. That's how it works in Brazil. So hospitals, they have to do almost zero capital investment for surgical devices. So when you come with a suggestion of buying a robotic system, they get shocked. So why now I have to pay $2.2 million in a robotic system? And then to change this culture and to tell them that a robotic system is like an anesthesia cart is very difficult and takes time. So the current business model in Brazil transfers the cost to the patients. So the patients at the end of the day have to pay rental fees on laparoscopic towers, which is ridiculous. But that's how it is. Then you might ask yourself, do we do a lot of open surgeries in Brazil or laparoscopic? The majority of the cholecystectomies in Brazil, the vast majority, is currently being performed open. It is a crime to do that. I mean, we can't stand this, Paraphrasing my fellow presenter, it is a crime. And we still do that. That's the reality where I come from. And then we have to adapt to this, So, again, Brazil has a different structure of the health system, which I believe it's somewhat similar to India. But basically, we have the public, and we have half of the population that depends only on that health system. And then we have the private with the insurance companies dominating 40 to 45% of the market. But pay attention to that, 50 to 60% of those insurances are cheap insurances paid by the employer. So generally those employer-based insurance, they are cheaper and they do not cover the high complexity treatments like robotic surgery, like cancer, like transplant. And then they left the patients reaching to the public. And we have 6 to 10% of the population that are phenomenally rich and they can pay for themselves whatever you charge them. So how many hospitals we have in Brazil? How many physicians? This is from 2017, right? We had about 400,000 physicians in Brazil. Only 46% of them, only 54% of them were with a residency. We had 22,000 general surgeons. Now we already have 35. Okay, that's 6 years ago, 7 years ago. And if you look here, we have 94,000 of hospitals and clinics. Half of them public, half of them private. It's a gigantic market. We increased to 560,000 physicians in the country. And guess what? 35,000 surgeons and 33,000 gynecologists. It's a lot of people trained and heterogeneously distributed over the country. Similar to India, the training is 94.5% in the public. But 70% of the residents, after they finish, they go work in the private. So how come is that even possible? I train 95% of my surgeons in the public, and then 70% of them have to work in the private. So 95% without robotic training have to work in 70% of the places that demand them to have robotic experience. So that's a complete nonsense. And if you look here, if you find about the residency programs, we have 2,000 spots per year, over 400 hospitals. So those 400 hospitals should have a robotic system immediately, because 70% of the graduating residents are going to need this robotic training. But the reality is, look at that. 2019, we had only 88 robotic systems in whole Latin America. In 2022, we have about 170 robotic systems in whole Latin America. So there is a big gap. There is a gigantic gap. We have installed in Brazil 110 robotic systems so far since 2008. How come is that even possible? We do 22,000 robotic surgeries as of 2022. There's another data here that is a little bit shocking. You might say, oh my God, there are 3,600 surgeons trained in robotic systems in Brazil, plus another 150 in Mexico. That sounds like a lot, right? 3,600 surgeons, right, in Brazil? But remember what I said. If you combine general surgeons, gynecologists, and urologists, we have over 74,000 surgeons in the country. So we have less than 5% trained robotic surgeons in the country. Shame on us. We have to improve. We have to go beyond that. So if you ask me, how do you see the future with Mantra in Brazil? That is the first alternative platform with quality to face the status quo. Surgeons in Brazil are eager to do robotic surgery. Everybody wants to learn that. If I open my mouth that we're going to have this conference there and everybody's going to be able to get trained by Mantra here in the same conference, everybody's going to go there. We have to take over laparoscopy. Laparoscopy is the grandfather of robotics. It's over and should retire as soon as possible because it's very expensive for the patients as well, if not more expensive than SSI Mantra. We should not do any complex laparoscopic surgery anymore. We have to stop that. We are bringing Mantra to Brazil. I believe in 5 years there's not going to be any complex laparoscopic surgery in the private practice. And hopefully in 10 years, none in the public system as well. Mantra has been proven to be affordable, accessible. It is democratizing the access to robotic surgery. And it has to be incorporated to general surgery training programs and medical schools. It has to. It must be included. That's it. And a little bit food for thought for Vishu and Dr. Srivastava here. You were talking about the bus. I already contacted these guys here. They have these volunteer missions in a boat in the Amazon rainforest. So I have a challenge for the engineers. Where are they? Engineers of SSI, I have a challenge for you. We got to develop this robotic to go face the Amazon rainforest and then be able to treat our Indios in Brazil, our native people that deserve this. Thank you very much. I think it was a pleasure to be here. Thank you.